Welcome to the Feeding Infants module. This brief module is offered as a complement to early care and education college courses that cover health, safety, and nutrition. It is not meant to be exhaustive, but simply highlight important best practices and key information, as well as provide you with additional resources. Breast milk is the normal nutrition and first food for infants. All major medical organizations promote breast milk feeding as the best support for health and development and recommend doing so for as long as both mom and child are able and want to continue. Child care providers play an important role in supporting lactation. To learn more, take the Supporting Breastfeeding and Childcare course on the Colorado Shines PDIS. This course is a great way to learn more about becoming a lactation-friendly childcare provider, which is critical in helping families succeed in meeting their goals and improving the health of your community. As a childcare provider, your support for breastfeeding families is critical to their success. A simple first step is to encourage families to feed their infants on site. You should not make a parent feed in a separate space, rather offer a space if it makes them more comfortable. Accepting, sorting, and feeding breast milk is a little bit different than other infant foods, but similar in many ways. Expressed milk should be labeled with the infant's name and the date that it was expressed. Encourage families to send in bags or bottles with smaller amounts so there is less risk of waste. You will notice that breast milk separates a little. All you have to do is gently swirl to remix it just prior to feeding. Please don't shake breast milk as the force can disrupt some beneficial nutrients. As with other feedings, always wash your hands in accordance with safe food and feeding practices when handling breast milk. These guidelines are only for healthy babies. Also, these are matching health and sanitation guidelines in Colorado, which require breast milk only be stored at the child care facility for 1 day and must be returned to the parent at the end of each day. Per CDC and USDA guidelines, breast milk can be stored in the refrigerator for 4 days for the parents and up to 4 hours at room temperature. Mix-ups can be upsetting to families and staff, whether it's formula or breast milk. Luckily, with breast milk, there's very little risk to the infant. Few illnesses are transmitted via breast milk, and in fact, the unique properties of breast milk help protect children from colds, ear infections, and other typical childhood illnesses. Still, when mix-ups occur, both families need to be notified, and they should be informed that the risk of transmission of diseases via breast milk is small. The family may want to contact the infant's primary care provider as well. The CDC provides helpful information that may also be shared to reassure families. Documenting as well as you can everything that led up to a mix up can be helpful for training and for updating policies and procedures to prevent future mistakes. It may be helpful to use refrigerator bins to separate the bottles of each infant and to use color coded bands or stickers as an added reminder. Preparing infant formula should be done with care and precision, whether by the parent or the child care provider. Mistakes can lead to foodborne illnesses, as well as nutrient deficiencies or excesses. All of these can lead to serious health consequences for the infant. Most child care programs will have a policy on whether the parent is responsible for preparing the formula or providing it to be prepared in the child care setting. Regardless, formula bottles should be prepared and labeled with the infant's name, as well as the date and time it was prepared. Always prepare according to the manufacturer's directions on the label. Regardless if the bottle contains breast milk or formula, these best practices should be followed. Bottles should be labeled with the infant's name and date it was prepared. Remember good hand washing techniques whenever you are preparing bottles and feeding infants. Nothing besides breast milk or formula should be in the bottle. No cereal or medicine. Warm the bottle in a bottle warmer or crock pot, but never a microwave. Microwaving can destroy some important nutrients and can cause dangerous hot spots that can burn an infant's mouth. When feeding infants, always hold them and pay close attention. Once an infant gives cues that they are done with the feeding, the bottle should be discarded within 1 hour. Consider preparing small amounts, such as 1 or 2 ounces, to help you avoid waste and reduce our tendency to encourage the infant to finish the bottle, even after they've already told us they are full. As you bottle feed the infant in your care, it's recommended that you use the technique of paced bottle feeding, whether the bottle contains breast milk or formula. This technique allows the infant's body to recognize fullness before the stomach gets overfilled. It helps prevent overfeeding, gassiness, spitting up, and obesity. Paced bottle feeding also promotes social and emotional development by allowing the infant time to interact with the childcare provider. We have included a video of paced bottle feeding in the resources. Whether breast milk or formula, infants should be fed only these two foods from birth until they reach about 6 months of age, unless directed differently by the infant's doctor. Another topic of great interest is introducing solid foods. The American Academy of Pediatrics and the Dietary Guidelines for Americans both recommend waiting to introduce solids, also called complementary foods, until the infant is developmentally ready. Breast milk or formula should be continued even as foods are introduced, as these will be an important source of vitamins and minerals for the infant through the first year of life. Developmental readiness for solids usually happens when the infant is about 6 months of age. As you know, children develop at their own pace and may be ready at different times. So, how can you tell when an infant is ready for solid foods? There are several physical characteristics, including being able to sit up and hold their head up well, and the loss of the tongue thrust reflex. These combined allow the infant to chew and swallow safely. The introduction of solid foods should be directed by the infant's family. As a child care provider, you can offer education and support to families, but the timing and progression of solid foods is ultimately the family's decision. The advice on what foods to introduce as first foods has changed over the years. Currently, the Dietary Guidelines and American Academy of Pediatrics recommend offering foods that are high in vitamins, minerals, and other key nutrients as first foods for infants. For most infants, different types of foods do not need to be introduced or offered in a certain order. The focus should be on offering very small amounts of single item foods that are plain, meaning no added sugar or salt. This will allow caregivers to watch for allergies, support the infant in the exploration of new tastes and textures, and still ensure that the infant is able to get the majority of their calories and nutrition from breast milk or infant formula through the first year of life. Infants can begin eating solid foods at about 6 months old. By the time they are 7 or 8 months old, they can eat a variety of foods from different food groups. These foods include infant cereals, meats or other proteins, fruits, vegetables, grains, yogurts and cheeses, and more. An important milestone for young children is learning about new food textures. The food consumed by infants early in life tend to be very smooth and mostly liquid. Introducing older infants to a variety of soft foods with different textures helps them learn about those foods and textures and explore what they like and do not like. These examples are great starter textures using healthy foods that can be worked into your menu and also into your lesson plans. Exploring new food textures takes planning and patience. Just as an infant may be cautious before plunging their hands into unfamiliar textures at the texture table, so too they may be cautious about new tastes or textures from unfamiliar foods. It may take up to 15 exposures to a new food for an infant to agree to taste it. Offering clear descriptions and comparisons to foods that might be familiar to the infant will help them prepare for the new food experience. Keeping a relaxed and non judgmental attitude will help them be at ease and thus more able to access the thinking and learning parts of their brain that are necessary for this type of exploration. Remember, learning about new foods is a lifelong adventure. Whether an infant eats a particular food in this moment is just a brief stop on that adventure. We are all tempted to feed an infant at a time that is more convenient for our own schedule and to encourage them to finish a bottle because we don't want to waste. I want to emphasize that these actions are harmful to the infant's physical and emotional development. Infants possess a natural ability to eat as much as they need, grow in a way that is right for them, and learn to eat the food their caregivers eat. They build on this natural feeding ability when caregivers trust them to determine how much and whether to eat from the food that is provided. Responsive feeding is a topic that could encompass a whole training and is deeply connected to an infant's social and emotional development. We hope you will follow up on this brief introduction by reviewing the resources at the end of this module. Responsive feeding is an approach that divides the feeding responsibility between caregiver and infant. The caregiver provides a safe and nurturing feeding environment and offers healthy meals and snacks in age-appropriate settings. During infancy, this means that adults are responsible for what the infant eats, and the infant is responsible for how much. This is known as the division of responsibility in feeding. Or to say it in another way, the caregiver provides, the infant decides. In childcare, it's best to have the same person feeding the infant so they can really learn the infant's cues and follow the infant's lead in terms of when to start and end feedings and build a trusting relationship with that person. Infants are also born with the ability to communicate. They use their bodies and make noises to let you know when they need to eat or when they are feeling full. These movements and noises are called cues. Infants usually give several feeding cues at one time. Note that crying is not a cue. Cues occur before crying happens. By learning and following the infant's cues, you will teach them to communicate their needs and to listen to their bodies when it tells them they are hungry or full. This is the foundation of healthy eating, and it can last a lifetime if we foster it. When watching the infant for hunger cues, look for the infant opening and closing their mouth, the rooting reflex, which is when they turn to the nipple, bring hands to the face, and sucking sounds. Crying is a late hunger cue. If you miss the early cues, the infant will get your attention by crying and will continue to show you their other cues to tell you hunger is why they are crying. Once the infant shows these cues, it's important to respond accordingly. This means, regardless of the schedule, when an infant shows they are hungry, the caregiver responds by feeding. And when the infant shows they are full, the caregiver responds by ending the feeding. Both are critical to the infant developing healthy eating habits and will last into their preschool years. And that leads us to the next slide, transitioning from bottle to a cup. While we may find bottles to be convenient, it's helpful for infants' growth and development to start the transition away from bottles around 6 months of age. You will be able to see infants master drinking from a cup about the same time they learn to chew and swallow foods. Provide breast milk or formula in a cup for a snack or one feeding during the day. Start with small amounts until the infant is used to and likes drinking from a cup to avoid wasting. Sippy cups are convenient for adults because they may be fewer spills, but for the infant, the sippy cup can lead to dental decay and tooth problems. And just as you practice other motor skills with your young children, learning to drink from a cup takes practice. As the infant continues to develop gross and fine motor skills, add in soft finger foods. Around 9 months of age, infants are ready to practice feeding themselves. Infants are able to mash food with their gums if they don't have teeth yet. Just as when introducing solid foods to younger infants, when introducing finger foods, start by offering a small amount, 1 to 2 tablespoons of each food, and offer more as the infant wants it. Offer soft finger foods and allow the infant to eat with fingers and a spoon. Again, single item foods with no added sugar or salt are the best choice. Offer foods 5 to 6 times a day, breakfast, lunch, and dinner with snacks in between, and stay patient. Remember, it can take 15 tries or more for an infant to learn and like a new food. Safety is important. Be mindful of choking hazards. Don't serve infants hard, raw fruits and vegetables, round or coin-shaped slices of food, or large pieces or lumps of food. Small bites of food will be easier for an infant to pinch and bring to their mouth and will reduce the chance of choking. Because infants' fine motor skills will take a little longer to develop, we would not expect them to be able to use a spoon or fork at this age. It may be enjoyable for them to hold the utensils and play, but they will unlikely be able to get much food to their mouths unless they are allowed to use their hands. Of course, it's important to wash their hands prior to mealtime. Once solid foods are introduced, it's okay to offer a very small amount of water at meals, but only water. Infants should not be given any kind of juice or sugar sweetened drinks and should not be given regular cow's milk until they are at least 1 year old. Young infants are not able to digest cow's milk and it can lead to serious health problems. It's also possible that honey may have spores in it that can cause infant botulism, so it should not be given to infants either. The information in this module is based on a variety of sources listed above. It highlights key points relevant to this topic but is not exhaustive. We encourage you to take a look at them for more information and to share with families in your care. Thank you for joining us to review Feeding Infants. This module is made possible by the Centers for Disease Control and Prevention and was developed in collaboration between the Colorado Department of Public Health and Environment, Colorado Department of Early Childhood, the Integrated Nutrition Education Program, Culture of Wellness in Preschools, Pikes Peak State College, and Front Range Community College.